mentioned laparoscopic and robotic surgery. How do I choose between the two? That's a great question. And the short answer is you don't really have to choose between the two. So when it comes to minimally invasive surgery, broadly speaking, there is laparoscopic surgery and robotic surgery currently. Beforehand, we were doing surgery open, meaning we made that really big incision that I was talking about and doing all our surgery through that. We then transitioned to laparoscopic surgery, which is those little incisions and doing the entire surgery through those little incisions. Your surgeon is holding kind of a thin, long instrument and doing the surgery right at the bedside. Now, a newer platform has been robotic surgery, which is actually quite similar to laparoscopic surgery. The tools are very similar. The incisions that you have with robotic surgery are very similar as well. They're usually slightly in a different location, but the size of those incisions are about the same, and usually the number of incisions is about the same. But those instruments are not connected to your surgeon. They're connected to a robot. And that robot is not what you see in the sci-fi movies where they're doing everything themselves, but they are controlled by your surgeon who is sitting right next to that robot. And the surgeon is on a console and they're doing everything that they're doing with their hands and their wrists is translated directly to the robot. Now, when comparing open surgery with minimally invasive surgery, there's a huge difference in terms of complication rates and recovery time, pain, all of these different things. But when it comes to comparing laparoscopic surgery and robotic surgery, there really has not been any data to show that one is better than the other when it comes to bariatric surgery. It basically comes down to what your surgeon feels most comfortable doing, either laparoscopic or robotic surgery. I am trained and comfortable doing laparoscopic and robotic surgery, but I do all my procedures laparoscopically because that's kind of how the hospital I work at and the clinic I work at, that's how we're set up. And so that's kind of how we do. That's kind of how that decision making goes. So when you're choosing a surgeon, what I would make sure is that they're going to do your bariatric surgery minimally invasively, so not through an open incision. But it doesn't really matter for you whether or not they're doing it laparoscopically or robotically. Okay.